Type 2 diabetes, also called type 2 diabetes mellitus, is a disorder that is known for disrupting the way your body uses glucose, sugar. It also causes other problems with the way your body stores and processes other forms of energy, including fat. Type 1 diabetes mellitus is a chronic medical condition that occurs when the pancreas, an organ in the abdomen, produces very little or no insulin. Insulin is a hormone that helps the body to use glucose for energy. Glucose is a sugar that comes in large part from foods we eat. Insulin allows glucose to enter cells in the body where it is needed and stores excess glucose for later use. Type 2 diabetes primarily arises from a condition known as insulin resistance. Insulin resistance occurs when cells in your muscles, fat tissues, and liver do not react properly to insulin signals. Several factors and circumstances can contribute to varying degrees of insulin resistance, including excess weight, insufficient physical activity, dietary choices, hormonal imbalances, genetic predisposition, and certain medications. Pregnancy. A small number of pregnant women develop diabetes during pregnancy, called gestational diabetes. Gestational diabetes is similar to type 2 diabetes, but it usually resolves after the woman delivers her baby. Type 1 diabetes typically emerges when the immune system targets and destroys the pancreas's insulin-producing cells, known as beta cells, in what's termed an autoimmune response. This process unfolds gradually, spanning several months or even years, often without any noticeable diabetes symptoms. Elevated blood sugar levels and the associated signs usually manifest once more than 90% of the insulin-producing cells have been compromised. Type 1 diabetes can affect individuals with a family history of the condition, but it can also develop in those without any prior family history of diabetes. Common symptoms of diabetes include increased thirst, known as polydipsia, and a dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tingling sensations in the hands or feet, slow healing sores or cuts, frequent skin and/or vaginal yeast infections. A1C test. This blood test, which doesn't require not eating for a period of time, fasting, shows your average blood sugar level for the past 2 to 3 months. It measures the percentage of blood sugar attached to hemoglobin, the oxygen-carrying protein in red blood cells. The higher your blood sugar levels, the more hemoglobin you'll have with sugar attached. An A1C level of 6.5% or higher on 2 separate tests means that you have diabetes. An A1C between 5.7% and 6.4% means that you have pre-diabetes. Below 5.7% is considered normal. Random blood sugar test. A blood sample will be taken at a random time. No matter when you last ate, a blood sugar level of 200 milligrams per deciliter, mg/dl, or higher suggests diabetes. Fasting blood sugar test. A blood sample will be taken after you haven't eaten anything the night before, fast. A fasting blood sugar level less than 100 mg/dl is normal. A fasting blood sugar level from 100 to 125 mg/dl is considered pre-diabetes. If it's 126 mg/dl or higher on 2 separate tests, you have diabetes. Glucose tolerance test. For this test, you fast overnight. Then, the fasting blood sugar level is measured. Then, you drink a sugary liquid, and blood sugar levels are tested regularly for the next 2 hours. A blood sugar level less than 140 mg/dl is normal. A reading of more than 200 mg/dl after 2 hours means you have diabetes. A reading between 140 and 199 mg/dl means you have prediabetes. If your provider thinks you may have type 1 diabetes, they may test your urine to look for the presence of ketones. Your provider will also probably run a test to see if you have the destructive immune system cells associated with type 1 diabetes, called autoantibodies. There are critical diabetes-related complications that can be life-threatening. Hyperosmolar hyperglycemic state, HHS. Primarily seen in individuals with type 2 diabetes, this occurs when blood sugar levels soar to very high levels, exceeding 600 milligrams per deciliter or mg/dl over an extended period. It leads to severe dehydration and confusion, demanding immediate medical attention. Diabetes-related ketoacidosis, DKA. Predominantly affecting those with type 1 diabetes or undiagnosed T1D, DKA arises when the body lacks sufficient insulin. Without insulin, the body cannot utilize glucose for energy, prompting the breakdown of fat, which releases substances known as ketones, making the blood acidic. This results in labored breathing, vomiting, and loss of consciousness. DKA necessitates immediate medical intervention. Severe low blood sugar, hypoglycemia. Hypoglycemia occurs when blood sugar levels drop below a healthy range, with severe hypoglycemia representing extremely low blood sugar. It primarily affects people with diabetes who use insulin. Symptoms include blurred or double vision, clumsiness, disorientation, and seizures. Emergency glucagon administration and medical assistance are required. In the long term, diabetes can lead to complications such as cardiovascular disorders, neuropathy, kidney damage, retinopathy, diabetes-related foot problems, skin infections, sexual dysfunction, hearing loss, amputation. Managing diabetes is a highly personalized endeavor, as it affects individuals differently. There are 5 primary components to diabetes management. 1. Blood sugar monitoring. Regularly monitoring your blood sugar levels is crucial to assess the effectiveness of your current treatment plan. 2. Oral diabetes medications. These medications, taken by mouth, aid in regulating blood sugar levels, especially in individuals with type 2 diabetes, prediabetes, or gestational diabetes. Various types are available, with metformin being the most common. 3. Insulin. People with type 1 diabetes rely on synthetic insulin injections to manage their condition. Some individuals with type 2 diabetes also require insulin therapy. There are different types of synthetic insulin, each with distinct onset times and durations. Insulin can be administered through injections with a syringe, insulin pens, insulin pumps, or rapid-acting inhaled insulin. 4. Diet. Careful meal planning and selecting a healthy diet tailored to your needs are critical aspects of diabetes management since food choices significantly impact blood sugar levels. 5. Exercise. Regular physical activity plays a vital role in diabetes management for all individuals, as it enhances insulin sensitivity and helps reduce insulin resistance.